See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hi, See You Now listeners. I'm Linda Benton, Senior Director, Corporate Equity, leading Johnson & Johnson Nursing and representing our 120-year commitment to advocating for, elevating, and empowering the nursing profession. Our incredible host, Shauna Butler, is on a well-deserved break this week, and so I am thrilled to step in and present the first in our special series, Meeting of Minds, where we get to listen in on the conversations happening behind the scenes between chief nursing officers and leaders from disciplines inside and outside of healthcare. These sometimes unexpected partnerships are driving transformative innovation and helping to solve some of the most complex healthcare challenges that we see today. In this episode, we join Chief Nursing Officer for Humana, Kathy Driscoll, and founding Dean and Professor for the University of Houston College of Nursing, Kathryn Tart. They have formed a unique collaboration through Humana's Integrated Health System Sciences Institute at the University of Houston. Even before the pandemic, they were working with students and Humana nurses to address the social determinants of health, such as social isolation, food insecurity, and access to care, looking at non-clinical ways to improve health outcomes with programs that would also expand the definition of care delivery. Through a focus on providing holistic and collaborative care, they've been able to strengthen the skills of their nurses, of their nursing students, and of others well beyond the medical field. It has been a huge win, even in the midst of so much loss. If all of this can be accomplished during a pandemic, imagine what we can build together when we can be together in person once again. What I love about this collaboration is how a shared vision, dedication, and passion serve as the very catalyst to solving some of the biggest problems we face, not only in healthcare, but in society as a whole. Lyndon Baines Johnson said, "The path to peace is a journey of 1,000 miles, and it must be taken one step at a time." The ambition behind some of these projects seems like a similar journey, and the magnitude of the problems are certainly complex and overwhelming. But taken one step at a time, we hear how change is not only possible, it's already happening. Enjoy.
Hi, I'm Kathy Driscoll. I'm a nurse, and I am the Chief Nursing Officer at Humana. I focus on making sure that our nursing population has a voice at the table and that nurses are valued, inspired, and motivated to work at Humana.
My name is Kathryn Tart. I am a registered nurse and the founding dean for the University of Houston's College of Nursing.
It's so good to be here with you, my good friend, colleague, and one of my favorite nurses, Kathryn Tart. And I was just reflecting on how we met, some of the really cool things that we did together, and was thinking back. I wonder if I thought it would take hold as quickly as it all did. We've kind of rolled with the punches that life has thrown with us over the past few years. It was 2018 when this all started. And I think you remember when we first met, Kathryn, right?
I remember very clearly I was asked to come visit, and I thought, what in the heck am I doing? I was able to come into the environment with Humana, and I felt so at home and so at ease with all the people there. And I think you were through a video conference chat at that time, and I was eating a sandwich. So we were kind of at lunch together virtually, and here we are again today virtually. But I thought, I wonder who this woman is. And I really admire her sense of purpose, direction, and vision. And I always like to tell the story when I was a new nurse. I worked at a Humana hospital. So now to be the Humana Endowed Dean's Chair of Nursing for the University of Houston College of Nursing and the founding dean for the University of Houston's nursing program, I'm always so very honored. It's one of my favorite things to tell. It's worked out better than I could have ever hoped for.
I don't think there's too many partnerships like the one that we have between an academic institution like University of Houston and an organization like Humana. I found it really energizing that we were going to come together as the Humana Integrated Health System Sciences Institute at the University of Houston. And there's a reason we call it the Institute, right?
That's right.
But really thinking about how does nursing, social work, pharmacy, optometry, and then the new College of Medicine, how do we learn together? How do we collaborate together? Because that's how we get to practicing together in a really strategic, collaborative way, focused on population health, focused on value-based care. So I was really excited about the concept and was even more excited when I heard more about the University of Houston and how committed you all are to the communities that you exist in, that you serve, and that many of your students come from.
Yes, the Institute has really been able to help us with the vision of interprofessional care and interprofessional learning, interprofessional service, and interprofessional research. And we've really been able to look at that vision and say, how can we work with our academic partners, our practice partners? And Humana is a practice partner that people wouldn't really think about. And I do agree with you. I don't know anybody who's doing what we're doing. And that in and of itself is really an exciting venture for both of us, because what Humana is looking at is how do we keep our members healthy? How do we make sure that our members are not socially isolated, that are not lonely? How do we keep them out of the hospital so that they can live long, fulfilling lives? How can we make them know that we care about them as individuals? And how do you do that as a really big institution like Humana? But I think you all have done that remarkably well. And we hear that when we talk to the members, when our students talk to the members, and when our students learn from your nurses, they're like, I did not know that nurses could do this kind of work. This is something that I'd like to do in the future. So it has opened the eyes of our students in ways that they probably would never have been able to even begin to imagine had we not moved forward with our relationships and the things that we knew that we wanted to do. And we've had great outcomes thus far.
Kathryn, sometimes you and I think of like all these ideas and everything, and we need the discipline of the great teams that we both have to keep us focused on moving ahead and being engaged by our mutual goals, mutual purpose, addressing social determinants of health, focusing on improving health equity. It's been a great partnership. And one of the things that when I think about what's gone really well, I think back on the last year. And one of the things that we saw with our Humana Medicare members, they are frequently living alone, they're older. When we were dealing with the pandemic, it really accentuated the social isolation, the loneliness, etc. So we came together both with the College of Nursing and the College of Social Work and partnered on a program called the PAPA program to address some of those needs.
The PAPA program has been so useful for the students. As new students, they are really trying to learn how to communicate. Therapeutic communication, the therapeutic relationship, that's probably our number one nursing intervention. And that has been rather difficult during this pandemic. How do you put a new student with somebody that they can talk to and have a faculty that's helping them through that? So the PAPA program allowed us to be able to use this therapeutic communication with people who wanted to talk. So it's not telemedicine or telehealth, but it's telecommunication. That gives our students an edge, and we're learning how to do that better. It helps the member exactly for what you're saying. people are so lonely. It is a breath of fresh air to hear a young voice on the phone, to be able to talk with them about some of the issues that they may be having. And it can be anything from talking about their own grandchildren to maybe how do I make that doctor's appointment. Those are the kinds of things that our students are able to be part of something really important in feeling like they're making a difference.
Yeah, and it's great. We're bringing health to people, and health is broader than the medical portion of health, but there's so much more to it. And this has been a really successful pilot that we ran together. We use a CDC measure at Humana on healthy days, physical and mental healthy days. And we've seen improvement in that. We've seen improvement in scores that measure loneliness. We've done since May of 2020 over 10,000 virtual visits to socially isolated seniors. So proud of the way that we've partnered on that, and that we've helped our future nurses and social workers to grow and to gain confidence in their skills too. And I think the other thing that we've really seen so clearly during the last year is this difficulty in connecting to primary care, especially when you think of environments where there are healthcare disparities, poverty, transportation is an issue, homelessness. It really is so important to connect with primary care, but yet there's so many barriers in the way. So one of the things that is underway, the nurse managed telehealth clinic, I know that's near and dear to your heart as well, Kathryn.
It is. It takes so much time, so much energy to build this kind of a clinic that we really are making sure that we're looking at the delivery of care for people who may not have care or intermittent care. It's really important that this become a service and it become a way of teaching our students and reaching out to our community. So with this nurse managed telehealth clinic, we'll be working with our interprofessional colleagues, social work, medicine, optometry, pharmacy, and also our College of Law. That's one of the things that makes the University of Houston so unique. We're the only nursing program in the Houston area that sits in a fully comprehensive university. So we have access. When you're in a health science center, you don't have that access. You're just a school of nursing and you're kind of a lone ranger. But when we're together in a fully comprehensive university, all the deans work together. It is unique and it's wonderful. We are educating our students appropriately for what is to come. And that's why the Humana Institute is so exciting, because it is a mechanism to help gather and bring us together so that we can do this. And Humana is doing it themselves. They have social workers, they have pharmacists, they have nurses, they have physicians. They're all reaching out to the members. We're teaching our students that this is a reality. We're looking at big data. We're looking at all kinds of things that we're privy to because of the relationship. So it is different. It's really different.
One of the things that we've really learned, Kathryn, from you and your colleagues at University of Houston is really that collaborative spirit. I remember being in a large conference room, and we had the deans from all of the colleges, nursing, optometry, social work, pharmacy, and medicine, but we also had the folks from law. We had arts and sciences people, and this passion for identifying the needs of the communities that University of Houston is situated in, and really being dedicated to helping to meet those needs and being dedicated to helping to educate and to help grow and develop a strong medical community within the greater Houston area has just been so inspirational. And we talk a lot about multidisciplinary care teams and things like that. But one of the things that really jumped out at me is how necessary and how powerful it is to bring in all these resources to support communities and to support the growth of students who are our future generation of healthcare providers.
One of the other pieces that we started learning from each other was how do we train our Humana nurses How do we train the new nurses coming in to Humana? How do we train our students to be able to talk to people and to help them move forward? And simulation is how we teach in a very safe environment. So we have mannequins that are very person-like. They look like people. They have lung sounds. They can talk. They can sweat. And so if I can say to my students, and we're going to simulate that a person is having a panic attack. We're going to simulate that a person is having a heart attack. We're going to simulate that somebody is hemorrhaging. We can make that happen within a very safe lab environment. We simulate a person who's in hospice. You know, a student can go into the clinical area like a hospital, and maybe somebody will have a heart attack that day, but maybe not. But I can make sure that the students get that experience. So when they become nurses then, and they are working, then I know for sure that they have gone through a simulated experience of a patient with a heart attack, and then they can start moving on that. It trains them in a way that everybody has met a certain level. And that's what's so wonderful with the simulation that we're doing with Humana, because now we can say, okay, this is a communication simulation of what we're doing, and we can make sure everybody's at that level. So one of the first things that we did, we hosted one of your multidisciplinary teams at our campus. I'll never forget, one of your colleagues said, we thought we knew everything at Humana. We thought we knew how to do all of this. And then we came and we looked at your simulation center and we went, oh my gosh, we don't know anything. So we said, well, let us help you. So simulation is something that's been fun, from what I hear, for your employees too, because at first they just started doing the simulation as volunteers, and it worked really well, and people realized, oh my gosh, look what we're learning. And so that was because we had organized the curriculum in such a way that it met your goals for your outcomes that you were looking for.
Right. Yeah. And that's a great point, because not everybody was familiar with a simulation lab or how it's used as a modality to healthcare professionals to develop. And we tend to do a lot of pilots and test and learns and many types of things, but it was really great for folks to get exposed to the simulation lab and learn new ways that we could practice things before we got to actual people. I remember another thing that you told me in one of our first meetings, and we were talking about how do we think about that lens that nurses don't always have to go into a career in an acute care hospital. Healthcare has just this broad continuum. And I was asking you about, where do your students go after they graduate? And I will never forget when you told me that 90% of University of Houston students go into some type of transition to practice program. And I had two immediate thoughts. One was, that's awesome, because it's very hard to make that transition, and all the support that you can get is great. And I said, oh my gosh, we don't have one. And how can I track new nurses to a managed care healthcare setting if we don't have one? So you, of course, spurred some research. You gave me lots of articles and good advice there, because I said we need to establish a nurse residency program. So we partnered with you and some of your folks. We partnered with the American Nurses Association to create a framework. You gave us a lot of really great advice about support needed and how you can be successful. And also the fact that many of the nurses that are graduating have had careers before and have had life experiences, and actually are really good candidates to go into a different type of setting if that's what they desire. So I was really excited when we had our first two Bachelor of Science nursing students from University of Houston who started as telephonic care managers in our special needs program in a nurse residency transition to practice program. So next time we have that conversation, I could say, yes, we've started this. We learn along the way. We're learning so much from them. And clearly it's a pathway that is really important. So I thank you for giving me that shock at that time, but helping us to really create this avenue.
The residency program is really maybe the pinnacle of what we do, building that curriculum and getting that framework put together. The residency programs are so critical because they do support that student as they're moving into practice, and they can see what they've learned, how it really does make a difference in the lives of people.
I really am wowed by what we've been able to accomplish together. I remember one of the first things that we did, and this was back in 2018, when we talked about how do nursing students know about other types of settings and how do they get this experience. So that was one of the first areas that we really started working together, was in the field care management experience with your students and our care managers, our nurses, who would go into the homes of our members after a hospitalization, help with transition. We would follow people with chronic care management, et cetera. And I think there was a little nerves on both sides to begin with. You know, our nurses saying, well, what am I going to teach this nursing student? And your nursing student saying, I'm going where? But
I'm going to be a nurse at a Starbucks?
Yeah. But that's been really, really great experience as well.
Yeah. And that experience, it became such a wealth of experience for the students. And I think your nurses loved it because then they saw that they were really teaching something that they love. And then COVID hit.
And then there was a pandemic.
Yes. And then we had a pandemic. And then it was like, we can't give this up. This Humana at home is so great. And so we said, let's do it, doing telehealth. And so we just turned on a dime. Your staff were like, okay, let's keep doing it. My faculty were like, okay, let's keep doing it. I remember some of my students saying, I was on the phone for 4 hours with that member because they needed XYZ help and I wasn't going to hang up on them. So they felt like they made huge differences in their clinical experiences in the lives of the members.
Yeah, you get as much as you give. And, you're developing, again, this collaborative skill because the members that they went to, they also became very involved in the learning experience and feeling really good about supporting our future nurse workforce. I love the idea of the breadth of the relationships that we've been able to have, these new strong relationships, help people to build their confidence all the way around and do good while we're doing it. As I think of virtual and changing needs of education, one of the areas that we've really focused on as the Institute and our organization has focused on as well is helping people to get an understanding of value-based care, ensuring that the care rendered to people in our healthcare system is of high quality, is the care that they need, that they're not underserved or over-receiving care. And it really is the concept of uniting providers of care and payers of care on these quality concepts, on patient outcome, including patient satisfaction, and aligning reimbursement for services with these quality measures. And as we move in healthcare from quantity to quality and think about that model as a model of the future, we were finding collectively that there was a lack of understanding around the basic principles and there was a hunger to learn more. So we had a really big team that collaborated on creating curricula through Coursera so that people could access it online.
Coursera is a platform that has different courses and they are publicly available. And it is a way to broadcast very timely key concepts.
Kind of like the micro-learning concept, that timely topics on everything. And some of them give you credit, some of them give you continuing education, some of them are just for interest, but it's really helping people to have easy access to learning opportunities.
So if a student or a person decides they're very interested in value-based care, They can take all 6 modules and they can have a value-based care certification. These are things that people can gather. They can say, I really want to learn more about value-based care. And this is a course that's been put together by the University of Houston and Humana. So it's academics and practice coming together to do this teaching. And if I complete that, now I can have a value-based care certification. Nurses are lifelong learners. The care we gave 20 years ago is not the care that we're giving today. People are people, but you have different tools by which you can be a nurse. The technology is amazing. The research, the evidence-based practice that we know works. The educational levels of our nurses help us understand the competencies by which they can practice. These are the things that help us to differentiate and make the care that we provide so much different than it was previously. Even our national licensure exam that all nurses take is really the gold standard worldwide. And so that exam now is changing to competency-based. We call it the next generation NCLEX. So we have to think about what is it that we have to teach our students so that they can be effective and they can be leaders, they can be clinical experts in this world of care that everybody's going to need. And how can we do that effectively and efficiently and with quality and safely? We're really reaching people in very meaningful ways.
Yeah, and in really timely ways too.
Yeah.
I know that both at University of Houston and Humana, we've incorporated the value-based care certification in some of our areas, but it is open on Coursera. I think there's been about 4,000 enrollments so far. So that's another really cool thing. And I just love the way that we've been able to come up with these ideas or identify opportunities and use that combination of technology and people who are willing to go at it. And despite having challenges in the past year with the onset of the pandemic, I think that we've stayed the course in our collaboration and our partnership. And some of the things that really have come to the forefront, especially during 2020 and especially with the pandemic, have been the exacerbation of social determinant of health needs. Things like social isolation, loneliness, food insecurity. Those are the things that we need to find ways to address before we can even get to their medical problems. And I'm really just happy with our collaboration that we've been able to connect our members and connect members of the community to resources that help to address those.
I am really looking forward to all that the future has to bring. If we've done this amidst a pandemic, I can only imagine what we'll be able to do as time moves forward. And, it makes me really proud to be a nurse. It makes me proud to be a nurse leader. And for our mission statement, our goal is that we have clinical experts and nurse leaders. And I think the relationship that we have with Humana fits that mission so very well, because clinical expertise is so very valuable and needed, and we have to have nurses at the table leading policy, leading healthcare for our nation.
We're going into new territory here, and we need to trust that we can learn from one another, that we can try new things. Maybe some of them won't work out perfectly, but we can keep going and we can keep tweaking things. It also takes commitment on a lot of levels. So Kathryn and I bonded from the beginning. We were so enthusiastic and felt like full speed ahead, but we both have colleagues and partners and teams that also needed to support our success. But most of all, it just takes this commitment and trust.
There was a period of time where we just had to say, we're going to do this. We're not really sure. We've never done this before. Nobody does things like this. And we're going to make it happen. Because, like I always tell our students, it's not about you. It's always about the patient. And if that's your end goal, then I think you can make it happen.
Kathryn Tart is the founding dean and professor for the University of Houston College of Nursing. Kathy Driscoll is the chief nursing officer for Humana. Together, they lead the collaboration that is Humana's Integrated Health System Sciences Institute at the University of Houston. You've been listening to the first in our special series, Meeting of Minds. Shauna will be back next week. For See You Now, I'm Linda Benton, and thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.